Hello, everyone. This is Dr. David Pascal talking to you from the Pascal Health Institute in the gorgeous Cary, North Carolina. We are having a very interesting winter. Every other day seems to be completely different. Sunday it was 80 degrees, Monday it was 50 degrees. We were just all over the place, but they say that variety is the spice of life, and we are certainly getting that right now. Today, I would like to talk to you about the role that the neuroinflammatory process plays in complex regional pain syndrome. So that's a mouthful. What does that mean? What it means is that when we have trauma, usually the triggering trauma that results in CRPS, then the body's immune system is activated and responds to it. Now, that is a good thing, but also a bad thing. And it all kind of depends on the timing. When we have trauma and there's tissue damage, then our immune system is engaged and it goes to the site of trauma, and we have certain cells that are like Pac-Man that are designed, called macrophages, that are designed to go and gobble up all the random debris and damaged cells. We have other chemicals that are going into the existing healthy cells and triggering them to uh, reproduce more, and if they have minor damage to repair. And what happens with this is we get this inflammatory response, and in that inflammatory response, we have more blood coming into the damaged area, because in our blood, we have not only all the subproducts that make new cells, but we have all the nutrients that are so vital for cellular repair. And probably most important of all, we carry oxygen in our blood. Well, if we have too much of that, too much of a good thing is a bad thing, right? So when we bring in more and more blood into an area, then we have more and more swelling. We have the body trying to mediate all of this, so we can even grow more nerves into the area so that we end up with more sensitivity. And when this happens in our nervous system is divided into two parts. One is our central nervous system, which is our brain stem, and our spinal cord. And then the second part of our nervous system is the peripheral nerves. So those are the nerves outside of the spinal cord. Those are the ones that, are going along your ribs to your back and chest muscles. They're going down your arms and legs to your skin and all of those muscles. They're going inside of your body to all of those organs. So those nerves outside of our uh, spinal cord, the peripheral nerves, they're usually the ones that are first impacted when we have some type of trauma, whether it is more like a bruising of the nerve, like we see with type 1 CRPS, or where there's actual cellular damage to the nerve, where the nerves can no longer even carry a signal, like type 2 CRPS. Um, but once we have this inflammation, this healing response, right? Inflammation is the healing response. Then some weird things happen, because if we have trauma for a short period of time, that's all right. All the ambulances come, they do all the repair, and everything gets repaired and goes away. Doesn't happen in CRPS. What happens is that inflammatory process continues for an extended period of time. And when that happens, we get chemicals in the damaged area that shouldn't be there. Then the immune system says, oh, we have all these inflammatory chemicals, so we need to send in a crew to handle that. So then it sends in more macrophages and activated cells, other of these specialized cells to do repair. And then the immune system goes, oh, there's a problem over there. Let's send some more. And we get into what's called an inflammatory loop. And this inflammatory loop will impact nerve function, right? It's going to make all the pain nerves hypersensitive. It's going to make all of your other sensory nerves, like light touch, deep pressure, temperature, vibration, all of them are going to be activated at a higher level as well. This is all outside of the spinal cord. Inside of the spinal cord, brainstem, and the brain, the central nervous system, the same process happens. We have this elevated activity, this response to the trauma, and now we're going to get inflammation in the spinal cord. We're going to get inflammation in the brain. This is going to then trigger an immune response in the brain and in the spinal cord, where once again, we have some macrophages coming in to clean up debris. We have other activated cells that are coming in to help mediate and stimulate cellular repair. But along with this, we are going to get a negative neuroplasticity. So we talk about in cellular repair how running proper pathways the right way can help the nerves regenerate neuroplasticity, but we can also lock in incorrect behavior. So when we have all of our pain fibers hyperfiring into the spinal cord and into the brain, that's making those, the more times those fire, the better they are at firing. So we become more and more sensitive over time. In addition to that, those signals will overflow onto the other sensory nerves. So now you have nerves that are carrying vibration and temperature and light touch and whatnot that are firing into the spinal cord, going up the spinal cord into the brain, and the brain is now misinterpreting that light touch, for example, as pain. Now we have brain generated pain, which is why, as I talked about in the past, so many people, the vast majority of people with CRPS, they do not respond to typical traditional Western medicine approaches to pain nerve, right? Which these are drugs or blocking procedures of the nerves that are occurring on the peripheral nerves. Most CRPS patients that don't respond well to that. That doesn't help them. It doesn't help them because their spinal cord and their brain is actually overfiring, misfiring all of these other nerves in the cord and in the brain, and now perceiving that as pain. So what do we do about that? Well, we need to decrease the inflammation. And not only the inflammation in the peripheral part of the nervous system, but we also have to decrease the inflammation in the spinal cord and in the brain. And remember, this is an immune system mediated process. It's our immune system, that part of our body that is responsible for healing us, for repairing us, that becomes dysfunctional. So we have our own support group, our own helper cells that are supposed to help and protect and repair us are now, they basically joined the enemy. Now they are creating more inflammation, and we end up with this maladaptive, malfunctioning immune system. Well, it takes an entirely different approach to impact the immune system than it does to impact the nervous system. Typical Western approach of physical therapy, maybe acupuncture, chiropractic, medications like we talked about, and blocking procedures like nerve blocks, nerve ablations, all of those, none of those actually are impacting the immune system. They're all impacting the nervous system to some greater or lesser extent. And that's why it's not very effective, because those approaches are approaching the wrong system in the body. What we found with the Pascal protocol, with all the patients that I've seen over all of these years treating CRPS patients, is that the foundation of care to lead to success, to get CRPS into remission, must be based not on the nervous system, but it must be foundationally based on repairing the immune system and restoring normal immunologic function. When you do this, then you can calm everything down, help restore the body's own ability to heal itself. And once you've done that, now you can effectively approach the nervous system and help heal the nerves. But you can't get very far healing nerves and nerve dysfunction when you have this massive inflammation going on. So if you're out there and you're wondering, hey, why have I done all these different therapies and I'm still not getting better? Why have I taken all of these drugs and I'm still not getting better? That's the main reason, is that all of those things, for all intent and purpose, are focused on the nerves themselves. And that's not going to work unless you first address the immune system. So a little short talk today, but a very important one. I hope that makes sense. If you have any questions, you can, down below this video, there's a place to ask questions. You can always call my office, 919-380-8000. You can email us at drpascalhelps@gmail.com. We would be glad to answer any questions. And of course, I am always available for a Zoom call, 20-minute intro consultation to help you as best I can. Hope this was of value to you, and I look forward to seeing you all again in a couple of weeks.